Currently, we are in Enugu State, Nigeria. We are at one of the clinics here in Enugu State, where the conditions here are very deplorable. This is a health clinic where they do primary care services as well as immunization. There is no electricity at this facility. There is no computers or areas where they can keep records. They are low on supply on drugs to the extent that they really don't have any drugs. This is a place where they see about 30 people a day, along with children, a day at this particular site. Also, there's an area in the back of this facility that is under construction and has been under construction for quite some time that will house the nurses that will live on this site. It is also a very unsecure area as well. There is a lack of security in this area, and which is a major concern of those practitioners that are working here. Primarily, these are nurses that are really volunteering their time. They are not paid much at all to provide the services for the young children. They keep some records on a weekly basis, and then they store them in a file cabinet that is just not safe or weatherproof to keep this documentation on all of the young people that come through to get their immunization. This is something that is very deplorable, that must be addressed by the world community. This is an examination room here in Nikkei, with many of their records, as you see, on the walls here, that gives them. So here is the 2011 quarterly disease pattern of malaria, diarrhea, measles, pneumonia, cholera, etc. This information is given here per quarter, January through March. They have 160 cases of malaria, 93 cases of diarrhea. Here, it went down in the second quarter. Malaria now 130, and now only 4 reported cases of diarrhea. It goes down even further here for malaria at 106, and it went up slightly by 2 for diarrhea. But here in October through December, the last quarter of 2011, it shot all the way up to 296 cases of malaria and 26 cases of diarrhea. This is how they keep some of their records. This is an examination room. This is an exam table that they use. They have one of the old scales here that they use to get the weight of their patients here. You see here, this is very unsanitary conditions, where you see some of the medicines and needles and all sitting out, which is unsafe and unsanitary conditions. Here is a desk right here where the nurses meet with the patients here at this desk. You see on the wall, there's still more information in reference to maternal health and child health here. It's all right. It's going to get better. It's going to get better. Yes, indeed. It's going to get better.
We're sitting over here. He's going to give us a briefing, and then we're going to do the tour.
That's it. It's going to get better. Yeah. How are you? Good, good, good. Thank you.